Hello everyone, my name is Ivy Lu. I'm one of the registered dietitian at the Toronto Western Hospital Bariatric Surgery Program. Welcome to the 1-month post-surgery class, vitamin and mineral supplement module. Initially, everyone was on chewable vitamins and mineral supplements. This is because chewable are easier to get down in the first month post-surgery. However, at this point, we're asking people to switch to pill form of supplements to continue for life. The pill forms may be easier to find, cheaper, and better absorbed. Let's start with the multivitamin. Remember, the dose of the multivitamin is 2 per day. Make sure you're taking a multivitamin with at least 18 milligrams of iron per pill. If you just started on a new bottle and unfortunately does not have 18 milligrams, then you can consider adding a separate iron supplement. You can send us a message if you need help finding a right iron supplement. You would have received a multivitamin handout with a list of multivitamin products we found to meet the guidelines, so you can use this to help you make an appropriate purchase. Some examples are listed on the slide. Next is the calcium with vitamin D supplements. The total dosing you need is 1,200 to 1,500 milligrams of calcium citrate per day. Calcium citrate is preferred form for optimum absorption after surgery. The tricky thing with calcium is that your body can only absorb about 500 to 600 at a time, so you need to spread out the doses of calcium throughout the day. You have also received a handout containing calcium citrate with vitamin D products that meet the guidelines, so use that to help you choose the appropriate option. Some examples are listed on the slide. Dosing will depend on which supplement you are taking because they all contain different amounts. Most popular one is the Weber's Natural Calcium Citrate found at Costco. Since these pills are only 300 milligrams each, this means that we'll need 4 per day to meet our needs of 1,200 milligrams. Since our body can't absorb all of it at once, we need to have 2 pills twice per day, each dose separated from one another by at least 2 hours and at least 2 hours away from your multivitamin, as the iron in the multivitamin can interfere with calcium absorption. So it is important as we space these out. Also important to know that if you are a postmenopausal woman, your needs are higher. Here we should aim for 1,500 milligrams per day. Lastly, let's review vitamin B12. You will need 500 micrograms of B12 per day. Previously, we had you on a chewable dissolvable B12 dosed at 1,000 micrograms. This is still okay to take, but make sure you're taking it every other day. Some people do an injection once a month. You want to be careful of B12 that are extended release or time release. This will be indicated by a clock icon on the supplement bottle. This would not be a good option for you because it takes more stomach acid and stays in the stomach longer before it is absorbed farther down the intestinal tract. But we want things to be more easily absorbed by your system since it is now producing less stomach acid and fewer enzymes post-surgery. So avoid extended release or time release vitamin B12 supplements. Now let's look at an example of what the supplement schedule may look like. Many patients choose to take their 2 multivitamins and 1 B12 every other day at breakfast time. Then at lunchtime and dinner, they take their calcium with vitamin D. With Bariatric Advantage Calcium Citrate Chewy Bites, you will need to take it 3 times rather than 2 times a day. Take 1 at lunch, 1 at snack, and 1 at dinner. This can be a lot of information and may seem overwhelming at first. You may find it beneficial to get a pill organizer to help you keep track, or set an alarm or timer on your phone to remind you to take your supplements regularly. Also, we're here to support you. If you have any specific questions about which supplement to use, at what dose, or when to take it, please message your dietitian to clarify. This is the end of this module. I shall see you in the next one.